Let's go to NBC News political reporter Josh Letterman, who's joining us again from Capitol Hill. All right, you joined us some 20 minutes ago or so after the Speaker, the Senate Majority Leader, had that news conference, or at least brought an update on things, and they didn't look too good. Did you learn anything else that gives us a glimmer of hope things will get done today in the last 20 minutes?
Well, we've heard from a few other Republican leaders, including Kevin McCarthy in the House. But so far, Alex, the sense of dire urgency that Americans are feeling across the country for financial relief right now has not seemed to break the logjam here on Capitol Hill. We're hearing from Republicans that they feel that they're very close to a deal. Mitch McConnell, the Senate Majority Leader, saying they still plan to have a vote today in just a couple of hours. Basically a procedural vote that would set things in motion to allow them to have a vote tomorrow on an actual piece of legislation. Fingers crossed that they actually have a deal to vote on at that point. But we also heard from Nancy Pelosi, the House Democratic leader, who rushed back in from California to be able to work on these negotiations. And I want you to hear a little bit about what these leaders had to say at the Capitol just a few minutes ago.
We're working toward bringing this together. I think it's safe to say we're very close. We have integrated a number of ideas the Democrats had over the last 48 hours with these working groups that you're familiar with. Now we're at a point in the discussion where people will shortly have to say yes or no.
We'll be introducing our own bill, and hopefully it'll be compatible with what they discussed in the Senate.
So no deal that's bipartisan at this point?
Right.
And Alex, you heard Nancy Pelosi there saying Democrats plan to introduce their own bill. That does not bode particularly well for resolving all of this quickly and making sure they can have a final vote tomorrow. We have been hearing from McConnell, other Republican leaders saying they don't think it's productive at this late stage in the negotiations for Democrats to be putting forth a new separate bill, that only makes it harder to get everybody on the same page and actually get a law passed. But from Nancy Pelosi, we actually overheard her speaking to her staffers as they were leaving a meeting today, saying we are so far apart. Alex?
Josh, what you just said there about Senate Majority Leader Mitch McConnell saying that he doesn't think it's helpful for Democrats to put forward their own bill at this point. Does that smack of the blame game? Are you getting a sense of the blame game here during this particularly heightened, intense time?
Absolutely. There's definitely politics being played here right now, as there always are. Republicans have a point that there's an urgency now that they need to do everything they can to get something out the door as quickly as possible. But Democrats have some very serious concerns about the legislation as it stands right now, most particularly about the restrictions or lack of sufficient restrictions on how companies are going to use this money to make sure that they really put it to use in the way that's going to most benefit Americans who are struggling, as opposed to shoring up the bottom lines of these major corporations.
Okay, so that is very important. So the Democrats, basically, they're trying to word-wise put in insurance that the money allotted to the businesses is properly used, or at least for the intent that this bill would provide, right? That it would be used for singular Americans, for employees and the like. That's what your sense is of this?
That's exactly right. Democrats don't want this money to be used for companies to give big balloon payments, major golden parachutes to their executives. They don't want it to be used by companies that are then going to lay off workers. And they don't want it to be used by companies to buy back their own stock to improve their numbers on paper, as opposed to making sure that they use that money to make sure they can continue to pay workers and get it out to real people.
Extraordinary that you're telling us that these two sides feel very far apart of this, according to Nancy Pelosi staffers. Okay, Josh Letterman, stay on this story. As soon as you have an update, come on back on the air. We'll appreciate seeing you then. Thank you. Let's go from there to the White House now. NBC's Monica Alba. Monica, look, you have the local officials, you've got the state officials, you've got all officials today sounding the alarm on the shortage of medical supplies for one. What is the administration saying on this?
The administration is saying, we hear you, we understand your frustration. Some of these items are on the way, but when pressed on a specific timeline or when these desperate states and local officials can receive them, they were very short on specifics. And they had another message to some of the other states that aren't as hard hit at this point. They said, if you have a way of obtaining some of these items on your own, you should go ahead and pursue that. Take a listen to how FEMA Administrator Pete Gaynor framed the priorities when asked this morning.
They have been distributed. They've been distributed over the past couple weeks. They're shipping today. They'll ship tomorrow. We find more and more mass to ship because we have developing great partnerships with the commercial sector out there through donations, ramping up production. We are trying to focus those shipments on the most critical hotspots in the country, places like New York City, Washington State, California. That is our priorities.
So how will a lot of these products be produced and then distributed? That's where the private sector comes into play. And the president is delighted this morning to share the news that companies like Ford, General Motors, Tesla are actually going to be making ventilators and other metal items. And that's something that they pitched the White House on themselves. These companies came and said, we are happy to help. And that is something the president is happy to take and receive. But again, the big question here, Alex, is the timeline. While these companies are stepping up, it's unclear exactly how long it will take them to produce the equipment, to distribute it, and then what is the plan for where it will go. We hope to press the coronavirus task force on all of this later this afternoon when they brief here at the White House.
Yeah, well, we can understand why the president's happy about that. Very good on all of those large companies that are trying to help in the way they can. Monica Alba at the White House, thank you. In less than 7 hours now, the entire state of New York will be placed under lockdown. Under Governor Cuomo's New York in place, the executive orders, all non-essential businesses, they're going to be closed at 8 p.m. New York is being called, of course, the epicenter now of this outbreak here in the U.S. 374 people have died. There are more than 15,000 cases across the state. That's nearly half the total number of cases in the U.S. And let me just remind you guys, we had to downward put that number of deaths. It was misspoken, not only by me just now, but by the governor. It's actually 114 deaths. So let's make sure we have that number correct. Joining me now from the side of a potential temporary hospital in New York City, NBC's Maura Barrett. Maura, you're near the Javits Center there. That is a convention center. It's a place for political activity, gatherings of all sorts, not for a hospital. What's the likelihood that this place will be used with hospital beds, and how many numbers might they be able to hold?
It's looking very likely, Alex, because just within the last hour or so, Governor Cuomo gave an updated press conference, essentially saying that he approved the state's side of using this space as a temporary hospital. The Javits Center here can house up to 2,000 patients, he said, and that's in addition to three other temporary sites that they're looking at in the state. And he said that he's approved all of these states' locations, 2 at state universities upstate and another at the Westchester Convention Center. So he's hoping that these 4 locations in general will help offset some of the overloading that's happening in other hospitals. But he did say that he won't be able to do it without federal support. Even though we have the approval for the temporary hospitals, that doesn't mean that they have the staffing or the supplies. And so Governor Cuomo is asking for expedited approval from the president. As we heard from Monica, we don't have a lot of details on that yet exactly. But basically, like you said, there are over 15,000 cases in New York State right now. And Governor Cuomo said that only 13% of those positive cases are currently being hospitalized. So these staffing supplies are essential in order to get these temporary hospitals going. He did say if approved and they can move forward, they could get construction going in just a couple days. He also was presented as kind of angry in this latest press conference because he's frustrated with the amount of crowds that we're still seeing in public spaces, in parks and farmers markets here in New York City specifically. We saw some yesterday on our area with you, Alex, and he also noted that young people are just not taking this seriously. Here's what he had to say in his press conference just last hour.
I want to make sure we're clear just so there's no confusion. Fact 1, young people can get the coronavirus. They are wrong when they say they can't get it. They can get it. 18 to 49-year-olds represent 53% of the total cases in New York.
So he's extremely frustrated. Young people, obviously, kind of the word on the internet, on Twitter, we're seeing all the time is young people aren't taking it seriously because they think that they can't get it. But he's noting here that you might be a carrier if you're in that younger age range, even if you're not showing any symptoms. And so, again, the guidance we're getting from health officials is to keep 6 feet, social distancing when you're in public with other people, wear gloves, wash your hands, don't touch your face. And all people need to be taking this extremely seriously, Alex, especially as we're seeing these numbers spike in New York State.
Absolutely. And what it means means to be a carrier, for anybody who doesn't understand the concept, it means that all of your friends with whom you're hanging out, all of your loved ones, your parents, your siblings, your grandparents, if you're a carrier, you can give it to them. So you know, you're a young person, you may feel vibrant and healthy typically, but you've got to pay attention to this and not expose yourself as best you can and stay home. Okay, Maura Barrett, thank you so much. Let's go to Illinois, everyone. A stay-in-place mandate is already in effect there. We've got more than 700 confirmed cases in that state. Illinois has one of the highest number of infected people here in the U.S. And joining me live from a testing center in Northlake, Illinois, is NBC's Garrett Hake. So you've moved from Chicago. What are you seeing there in Northlake?
Alex, this is one of 2 testing sites that was set up by the HHS in conjunction with Walmart. They're trying to essentially do this as a pilot. You can see the testing site behind me. We're obviously operating at a safe distance here as prescribed by HHS. What this testing site is designed to do is process up to 150 people a day in their cars if they come here. Now, this is not for the general public. This is only for first responders. It's only for medical professionals. And even then, it's only for people who say that they've been in contact with someone who has tested positive for the virus. That's in part because of the limitation on testing. These 2 sites, one in Northlake, another in Joliet, Illinois, can only process 150 tests per day. We took a lap around the parking lot a little while ago. There was probably 25 or 30 cars here lined up. The testing sites are only open for a few hours, about 10 to 4 every day. They're just trying to get those frontline people, the folks who really, frankly, need to be out there to help the rest of us, police, firefighters, doctors, nurses, and so forth, to get the testing that they need to know whether they are safe to continue to be out here doing their jobs. But again, I urge people who are watching this, if you're somebody who thinks you might be sick or somebody who wants a test, this is not the site for you. You need to talk to your doctors. Please don't come out here if you don't fit the description of what I've already described. Now, you mentioned that stay-at-home order that the governor put in place here that took effect yesterday afternoon. Look, a lot of these governors, particularly in states not named New York, are taking some political pressure for this, for acting so strongly on the front end of this to try to prevent the outbreak getting worse than it already is here. You mentioned 700 plus cases in Illinois thus far. This morning on another network, the governor defended his decision. Take a listen.
Unless we tell people to stay home and to stop interacting in the way that they were, we're going to see more and more, thousands more, tens of thousands of more deaths than we otherwise would. So that's why I had to take the action that I did. I don't relish it. Frankly, this is a competition, you know, in the decision-making between saving lives and saving livelihoods.
So there you hear J.B. Pritzker, the governor of Illinois, defending that decision, a decision that is going to be in front of a lot more governors pretty soon, I think, Alex.
Okay, Garrett Hake there in Northlake. Thank you for the latest on that testing center there. With me now, Dr. Vin Gupta. He is a pulmonologist and global health policy expert. Dr. Gupta, with a welcome to you, sir. How are medical professionals determining who is eligible for a test and who's not? We just heard my colleague Garrett Hake there talking about those drive-through testing centers. How does someone know if they can go to that drive-through center?
Well, in a lot of cases, this is employer-sponsored. So hopefully you have access to information and marketing material that essentially says where you can go to get a drive-through test. But this is not information that's democratized. Not everybody has access to that because you have to know what's happening and you have to have a covered benefit for it. And so this is not something that's broadly available to the public quite yet. Hopefully that's going to change soon. And I think there's going to be relief soon for testing. To your question about how doctors are determining who should and should not be tested, I have to say at this point, we're testing people who have what we call a high pre-test probability of being positive for coronavirus. And so that means, do you have compelling or consistent symptoms, shortness of breath, fever, cough, symptoms that we know are consistent with this virus? Did you travel to an endemic area? Now it doesn't really matter anymore because, frankly, the United States is in a global epicenter. But that's how we're trying to really frame who gets a test, who doesn't. It's imperfect. The way that we're approaching this is completely imperfect, and I would push and challenge really the utility of broad testing at this point, as Dr. Fauci and others have already said in their daily briefings. At this point, is broad testing really what we should be doing versus focusing more on ICU surge capacity and other mitigation efforts. I think that's the thing, that's the challenge we're wrestling with.
Okay, and I appreciate what you're saying there. There are those who will listen to you, though, Dr. Gupta, and they will say, but look, I would be better served myself dealing with my symptoms, understanding that what I have is maybe not just a cold or some strain of the flu, given that we are in flu season right now as well, if I could get a test. Sort of the virulent way that this can be passed along, does it stand to reason that at some point it makes sense to get everybody tested?
In the aspirational, idealized world, every American gets a test, of course. And I think that's what we try every year with the flu. If you're having consistent symptoms, you should get a flu test. But here's the problem, Alex, and this is the problem that I anticipate we're going to face with coronavirus. Just because we have all these rapid tests now available, hopefully this week, broadly, some at home, doesn't mean that they're going to perform well. We hope they're going to perform well. But every year with the flu, the rapid flu test that maybe you've gotten previously, I know I got earlier this year, that's falsely negative 30% of the time. So I think we need to be careful viewing testing as a panacea for this outbreak. That's why so many people are messaging appropriately on stay at home. We need a national lockdown because testing's not going to cure it all. It's going to, I worry it's going to give people a false sense of reassurance because we have no idea how the test is going to perform in real time. We hope it's going to perform great, but who knows?
Yeah, certainly uncharted waters here. Okay, we've heard the president who's been prompting the promise of 2 long-used malaria drugs that are still unproven against the coronavirus. Dr. Fauci has made that point repeatedly, but they are being tested, at least in clinical trials. Experts are saying more research is needed. How about you? Where do you come down on this?
You know, I've personally cared for patients that we use the word empirically in medicine to say that they're just sometimes being put on some of these drugs on a case-by-case basis, like Plaquenil, a drug commonly used to treat lupus and as a less potent form of chloroquine, which is an anti-malarial. I couldn't agree more, though, with Dr. Fauci, and I don't know a public health official or pulmonologist out there who also doesn't agree with Dr. Fauci, which is to say we don't know if the combination of chloroquine and his
Dr. Vin Gupta, unfortunately, I think that we've had a hiccup there with our connection with him, and I'm very sorry for that. Oh, I'm told he's back. All right, Dr. Gupta, if you're back, you were wrapping up an answer there with regard to how you felt about the tests overall, but I did want to have you listen to one thing first and get your response, sir, and that is what former CDC Director Dr. Tom Frieden said this morning on Fox. Let's take a listen to that because this is an important soundbite, and I want to get your reaction on the other side.
I would feel a lot safer if it were clear that the CDC is both at the table where the decisions are being made and at the podium where they're being explained. In order to do more and protect people more, we need their full involvement. Fighting this without CDC central to the response has never been done with an infectious disease threat in the U.S. before, and it's like fighting with one hand tied behind your back.
What do you make of that assessment?
I couldn't agree more with Dr. Frieden. Of course, our CDC officials need to be front and center. They're scientists. In many cases, they're physician scientists and epidemiologists. Those are the right people to be leading this effort, to be informing. When I cut off, I was just finishing a sentence on azithromycin and chloroquine to your question about these drugs I'm talking about. The CDC, I'm sure, has an opinion on that. And because they're experts in this field, we need randomized controlled trials in an ideal world to know, is this combination effective? I was saying earlier that we're empirically starting some patients on some of these drugs without really true knowledge on whether it's beneficial. And they do have side effects. So it's important to know and to really lean on our experts here. And so, yes, couldn't amplify Dr. Frieden's sentiments enough.
Okay, Dr. Vin Gupta, I'm glad we got you back. I'm glad we're able to wrap this up with you there from Seattle. Thank you so much. The crisis in Italy, we've got a live report from the front lines of the coronavirus pandemic there and the warning that doctors have for right here in America.
As of now, the numbers are continuing to increase. What we're working very hard to do is to keep the rate of increase of the spread of the disease to a level that we can manage it in our hospital system. We have 53,000 hospital beds available. Right now, the curve suggests we could need 110,000 hospital beds, and that is an obvious problem.
New York's Governor Andrew Cuomo anticipating a shortage of hospital beds, and the worst-case scenario is the number of coronavirus cases continues to rise here in New York, which is now considered the epicenter here in the United States. New York City residents, they are out on the Upper West Side today. The weather is decent, that's for sure. They are preparing for the governor's New York on pause order. That begins tonight at 8 p.m., and it says people should limit outdoor activity, limit gatherings. It requires all non-essential businesses to shutter. Some New Yorkers we spoke to say they are already practicing social distancing.
I think it's already kind of happening, especially in this neighborhood. So I have a dog, so I usually walk my dog around 9:30, and it's nobody on the streets.
We've been at home for the last 2 weeks, so for us, we really haven't been out much other than to buy food. Now we try to go to Trader Joe's. The queue is around the corner, so yeah, we're not gonna go back to our local store.
And even before the official shelter in place or lockdown, we were all trying to practice that social distancing. So I think my hope is that this just reinforces for maybe people who weren't taking it as seriously, and you know, just kind of gives them that extra nudge of, hey, this is a serious thing.
Well, joining me right now from the Upper West Side is MSNBC's Lindsay Reiser. Lindsay, notably, there is one kind of business that will not be closed tomorrow. That would be liquor stores. What is the guidance from the governor's office that makes this an essential service?
Yeah, that's really interesting, right, Alex? So all non-essential businesses, as you mentioned, closed tonight at 8 o'clock, but grocery stores will stay open, places like hospitals and liquor stores. First, I want to give you a look at what's happening around here. So it's a Sunday. Usually you'd see a lot more people here on the sidewalk. One person who I spoke with actually said it looks like an apocalypse, but take a look. There are people out and about. That's because those grocery stores are still open. There's a Whole Foods down that way. There's a Trader Joe's down up this way. And I want to show you something right here. This is a place that's going to still be open tonight. Columbus Avenue Wines and Spirits. You see here we have a socially distanced line. You can also see a rule here on the sign, limit 3 customers at a time. And I spoke with the owner here of the liquor store about why he thinks that this is considered an essential business.
I think everybody has their own response and need in life, but as I said, I think clearly wine is a way for people just to relax and mitigate some of the stress that they're feeling.
So, Alex, he also told me that he thinks if stores that sell wine, beer, and liquor weren't considered essential, he thinks that people might even be making this pandemic worse by traveling across state lines to try and get it.
Yeah, I got to tell you, Lindsay, it's funny you talk about that social distancing and the marking there. I was inside of a CVS, and on the floor there were blue tape markings that were a number of feet apart, and people were staying in their square right on those lines. It actually was fascinating, and people adhered to the rules on that. Let me ask you, though, yes, he's lucky that his liquor store is going to stay open from a business standpoint, financially speaking. How long can he sustain? Is he worried, though, about a drop?
So I asked him that very question, and he said right now they're really busy. He said people are treating them like a grocery store. People are going in, they're stocking up, maybe not hoarding like toilet paper, but he said they're so stocked that he's actually worried about filling his shelves again with restock through all of this. But he did say he is just trying to keep his employees on the payroll. He's trying to keep the doors open, so he'll do whatever he can to keep these employees working, to be giving them hours.
Okay, Lindsay Reiser there on the Upper West Side of Manhattan. Thank you so much, Lindsay. Let's go to the latest now from Italy, which is the global epicenter of this virus. The numbers of deaths and new cases still climbing every day. 793 people died in Italy yesterday, even as some Italian cities are entering their 3rd week now of being on lockdown. NBC's Matt Bradley is joining me from Rome. Heartbreaking is to say the least what's going on there. But are you at all able, Matt, to gauge how people are reacting to these latest numbers? Are they heartbroken? What are they doing to stay positive?
Well, you know, it's hard to tell because, of course, here in Rome, we're on a comprehensive nationwide lockdown, just like everywhere else in Italy. Walking around the streets today, I saw very few people. You know, everybody who I did see was on some kind of business. They seemed to be going out mostly to get food, to go to the pharmacies. People didn't seem particularly upset, but, you know, people who are in their homes, I mean, I think that there's a lot of fear that's been going around, especially as these numbers continue to climb. You mentioned 793 yesterday. That was a record breaker, not just for Italy, but worldwide from the coronavirus. 793 in one day. It's going to be hard to beat, but Italy today just announced their numbers in just the last 10 minutes. It's now at 651 deaths in the last 24 hours. That's not as high as the 793, but wow, I mean, that is a huge number. They also said that there were 5,560 more positive tests in just the last 24 hours, bringing that number to nearly 60,000. Among them, Placido Domingo, the famous opera singer who announced for Facebook that he had just tested positive for the coronavirus. And, you know, one of the things he mentioned in his Facebook announcement was that he doesn't have symptoms. It's not really that bad. And, you know, we're hearing that from a lot of people. That's one of the reasons why this is such a pernicious illness. But you wouldn't know that going into the hospitals in northern Italy. My colleagues at Sky News visited a hospital in Cremona, Italy, and produced this report, which is really heartbreaking. He spoke to a few doctors and nurses. Take a listen.
Very dangerous, is a disaster, is a tsunami. We opened this side of the department to intensive care only yesterday, and today is already full. Don't think that it is happening here and it can't happen everywhere else.
Yeah, we also saw just today Spain had nearly 400 deaths. And, you know, France is coming up right behind them. All of these countries are going to start registering sky-high numbers, maybe not, hopefully not, on the level of Italy, which has been a complete disaster. But, Alex, this is a Europe-wide spread, and it could wash up onto American shores before you know it.
I got to tell you, talk about these numbers. There's so many, they're so high. But if you break it down and think each individual whose life has been lost and those loved ones who are mourning, some of them, as I understand, not even able to have funerals and the like because funeral homes are completely overwhelmed. Yeah. You've got churches that are serving as morgues right now. It's just... It is stunning, but nonetheless, we thank you for giving us the reality check from Rome. Matt Bradley, appreciate that. New calls around the country today for the president to use the Defense Production Act to allow the federal government to impose some controls over private industry in order to make items like ventilators and masks.
The Defense Production Act, we know the president invoked it. Is it being used or not? Or are you wanting companies to voluntarily pitch in here, and you're only going to use it if they don't voluntarily pitch in?
Yeah, so I think it's an insurance policy, right? It's a lever. If we have to throw that lever, we will. We haven't had to use it yet. Will we have to use it? Maybe.
All right, we'll see on that. Joining me now, Jean Ross, president of National Nurses United. Jean, with a welcome to you. What is it like being on the front lines of this pandemic?
Well, it's actually quite scary. We are being told by everyone from the White House to our employers to the CDC how valuable we are, how necessary, but actions speak, and we are being treated as if we're expendable.
How so? Expand on that. How are you being made to feel that you're expendable?
Well, we ask repeatedly. We are begging, we are demanding the proper protective equipment, the PPE. We just did another national survey of our nurses as of March 20th. 55% still say they don't have access to N95 respirators on their unit. 27% they say they have access to PAPRs, the powered air purifying respirators. We are told that places are conserving everywhere because there's not enough, and we know that that will likely come to a head, but right now we're not at that point. So where is the equipment?
So look, on the issue of masks in particular, Jean, the president spoke yesterday about what doctors are doing to try to embrace this shortage of masks. Take a listen to what he said.
We have very good liquids for doing this, sanitizing the masks, and that's something they're starting to do more and more, they're sanitizing the masks.
And we should say the president said that because he doesn't like seeing what he perceives as being the waste of these masks. He's wondering if this is a new way to approach things. What are your thoughts on that? Are there dangers of not disposing after each use?
Yes, there are. It is not sufficient to use non-disposable. You're supposed to have a one-time use. For the N95s, they need to be properly fit. Also, they need to be fit tested. But for the droplet precaution, the masks that are used instead of the N95s, you can ruin their efficacy. It is insufficient to use anything other than an N95 in this situation.
Okay. Jean, I know that your organization made news somewhat after the CDC weakened its guidance on healthcare worker protections. Give me your position right now on these loosened restrictions, even though, as we understand it, the end result is bringing more healthcare workers into the fold.
What they need to do is strengthen their precautions, not loosen them. I mean, it feels like a battlefield triage here, which if we don't get this stemmed, it's going to be. But right now, we are told there are supplies. Where are they? The hospital nurses that talk to us and say they have had them in their hospital, they're under lock and key. The nurses can't get to them. This is ridiculous. And we are also hearing from our nurses who have had positive symptoms and are home that if the fever's gone away, they should come back to work. This is unconscionable.
Jean Ross, very important statements you have made, and I hope that many have heard you there from Minneapolis. Appreciate your time. Best of luck. Our thoughts are with you. Let's go right now, everyone, back to Capitol Hill. That's where my colleague NBC's Josh Letterman has some breaking news for us. What you got, Josh?
That's right, Alex. Some disappointing news. We have just learned that Senator Rand Paul of Kentucky has tested positive for coronavirus. The senator's office putting out on Twitter that he has tested positive for COVID-19. His office saying that Senator Paul is feeling fine and is in quarantine, and that he is asymptomatic at this point and was tested out of an abundance of caution because of his extensive travel and events that he had held recently. The office going on to say he was not aware of any direct contact with any infected person, but obviously very concerning news. This is the first member of the U.S. Senate to have been tested positive for coronavirus. We know that 2 members of the House of Representatives at this point have also tested positive for coronavirus, but obviously this is an illness that is not sparing people of any part of society. Alex?
Yeah. Hey, Josh, do we know if every member of the House and or Senate are able to get tests if they want them? Because the point you're making about Senator Rand Paul, who didn't knowingly come into contact with someone, but he does travel an awful lot. So as you described it, out of an abundance of caution, decided to get a test done. Is every member of Congress able to get one if they want to?
We don't know the answer to that exactly, Alex, and we know that this has been varying from state to state based on the availability of tests in those states. And so obviously members of Congress are coming from all different parts of the country. But there has been a lot of scrutiny on whether people who are in positions of power, the wealthy, the well-connected, are able to get access to tests in a way that's different than the average American. We've seen basketball players able to get tests very quickly. The vice president was tested yesterday, got his results back very quickly. Obviously, there are some legitimate reasons why you'd want to make sure, particularly that people who are in Congress and are responsible for passing the legislation that we need right now to help people in this crisis, are able to make sure that their health is preserved. But there have been some very real questions about how the tests are being doled out and whether people such as member of Congress or other politicians might have special access.
Any indication where the senator is self-quarantining? Has he gone to Kentucky, do you know, or is it a home potentially in Washington, D.C.?
We don't know exactly where he is, but I can tell you we have not seen Senator Paul here at the Senate today. There are a lot of senators who are here as they're working through these negotiations. Senator Paul, apparently not one of them.
Okay, and obviously I know that you join me and everyone else in wishing him the best as he recovers from this, and hopefully he stays asymptomatic. Let me ask you just really quickly, because the news you gave us about 1 hour ago right now was that we had both the Democrats and Republicans very far apart with regard to that third coronavirus aid package, which Congress desperately needs to pass, get to the president's desk, to get the money funneled to those who need it the most. Any other news, any glimmer there in terms of the negotiations between them in this last hour since we've spoken?
Well, we've been told by aides on both sides, Alex, that they are still in discussions. It's not as if they've packed up and gone home for the day. They're continuing to work this out in anticipation of a vote that they say is still planned for 3 p.m. This is a procedural vote. It's not the final deal, but they are still planning to at least try to move in the right direction today.
Okay, we'll keep a very close eye on that activity at 3 p.m. with your help. Josh Letterman, thank you for that. Shoppers in some areas like Chicago are still faced with empty shelves when they try to stock up on supplies for the lockdowns. Retailers have put limits on some items to discourage panic buying. Some food banks will remain open through the shutdowns to help those in need. America apparently is not short on food, though, but a huge burden has been placed on its supply chain since the beginning of this coronavirus pandemic. And now NBC is reporting that supermarkets are not able to hire workers fast enough to fill grocery store shelves. This while U.S. farms are expecting shortages in labor there as the State Department is delaying visa workers from Mexico and other countries. Joining me now, host of What's Eating America, Andrew Zimmern. Andrew, your thoughts on all of this, the shortage of labor for those farm workers in the field, the shortage of not being able to really get those grocery store shelves stocked quickly enough.
My fear, Alex, good afternoon, is that it's slowly going to get worse. You have to remember that when there's a crisis of this magnitude, and this is certainly the greatest global crisis, national crisis of my lifetime, and I'm 58, it reveals the flaws in every single piece of the system. We're seeing this in our health system in terms of getting PPEs, and we're also going to see it in our food system in terms of certain policies and things that people have been shouting from the sidelines for a generation to get fixed. Those problems are now coming home to roost. So just look at the supply chain when it comes to food. You have to remember that a huge portion, anywhere from 50 to 70% of that supply chain, workers in the field, meat cutters, people who work on fishing boats, right, are all immigrants. A lot of them come through the H-2B visa programs. And so as we begin to shut our borders, as people begin to get sick, we're going to see fewer and fewer people showing up for work. The other big problem that we have is because we haven't faced down immigration reform, we have kept an entire group of people, as much as 25%, maybe as much as 40% of our agricultural labor force are illegal immigrants. Those people are being marginalized and have been for so long. They're not going to show up at the local clinic. They're not going to necessarily report systems because they're afraid of being deported. They are also hyper motivated to keep working even when they're sick because they have nothing to fall back on, and they're the most vulnerable people living check to check, and they're vital to our supply system. So keeping that clean and going is of greatest concern for me. I want to underscore, we do have lots of food here in America. It's distributing it, and you know that includes truckers on the highways that concerns me. The other big thing that we have to remember is we're coming into the spring planting season for a lot of the country, right? So as it begins to warm up, what's going to happen to that farm labor crisis that you mentioned? I believe, just anecdotally, as well as just by sitting down and doing the math myself on the back of a napkin, there's no way, as the country gets sicker and we quarantine more and more, we're not going to have more people showing up to do those jobs. We're going to have less.
Yeah. Andrew, I had wanted to play a clip of the show tonight, but I really wanted to get your thoughts on all of this, for which I'm grateful to get. I want to let everyone know that it is the 5th. It is the final episode tonight. It's been a fantastic series. Original programming here by MSNBC. What's Eating in America? Folks can watch it tonight at 9 Eastern. And if I'm not mistaken, this is all about school lunches, the kinds of foods that kids are eating, those that are dependent upon school meals for their nutrition. It talks about childhood obesity and diabetes. It is all-encompassing, and it's going to be great. So thank you, Andrew, for speaking to us about so many different facets of that which we consume every day. Appreciate it. Good to see you. And the mayor of Cincinnati, Ohio, is going to join me next on the effort to contain this virus in his city. Let's go now to the Midwest. It's not the epicenter of the coronavirus here in the U.S., but it is still very much affected by it. In Ohio, there are 247 confirmed cases, 3 deaths reported thus far. Joining me now, Cincinnati Mayor John Cranley. Mayor Cranley, look, it seems like the coasts are grabbing a lot of the attention. The middle of the country has gotten overlooked to some degree. I'd like you to give me a real-time snapshot of what is happening in your city there.
Well, we are taking every precaution necessary to make sure that we can continue to provide police and fire and clean water and sewer services. The city government is continuing. In addition, we have instituted social distancing throughout the state, and frankly, Ohio has kind of been leading on that front. And so we're trying to keep people as safe as we possibly can at the beginning of this crisis, which we know is going to go on for several weeks.
Absolutely. You mentioned that you guys have been aggressive from the get-go. In fact, the Ohio governor, right from the beginning, did a few things in the state of Ohio correctly. Maybe things that the federal government did not do. Do you see a discrepancy there? Are there things that you did in Ohio that you think ought to have been done by the federal government?
Yes, and right now, what we really need are respirators. We need testing. We need masks and gloves for our police officers, our firefighters, our healthcare workers. We need these things mass-produced immediately. I believe that over the next several weeks, we will need military assistance throughout the country. And the wonderful medical assistance and expertise that our military has to offer. Although, candidly, as we ask for that kind of assistance, we also want to ensure that as people get called up, that police and firefighters who are in the reserve, many of whom in our own city, are left in cities because they are going to be on the front lines and ambulance calls, front lines, taking people to hospitals, et cetera. But right now, what we need are mass-produced respirators, mass-produced masks and gloves, and ultimately, since we think this pandemic could come back in the fall or ongoing, we can't allow our economy to shut down the way it has again. And so we need to really model the examples out of Taiwan and Hong Kong with temperatures and the ability to isolate people in a way that won't be as damaging as what we have to do now on an emergency basis to save lives.
Yeah, Mayor Cranley, are you worried about the number of cases climbing, given that you don't have the tests you need yet?
Absolutely. I mean, at the same time, I'm extremely proud of the effort that we have instituted at the state and local level, and I support Governor DeWine's bold and courageous steps over the last several weeks, and we are implementing similar measures at the local level. We are prepared for this. We are prepared to provide clean water. We are prepared to continue to provide ambulance and medical services. And we have our 5 major hospitals in Cincinnati. We are communicating on a daily basis to prepare for the surge. Obviously, it could exceed all expectations, but we have a very good plan in place.
Cincinnati Mayor John Cranley, it is very reassuring to speak with you, sir. Best of luck there in Cincinnati. Appreciate your time. And for all of you who want to share some breaking news, we have German Chancellor Angela Merkel is now under self-quarantine. Her doctor, her physician, has tested positive for the coronavirus, so she now is staying at home in an abundance of caution. Officials say she will be going through testing over the next few days to see if she has caught that virus. Of course, we just recently told you about Senator Rand Paul of Kentucky having tested positive, he as well, in self-quarantine. That's a wrap for me today on a very busy day of news on this Sunday at MSNBC. I'm Alex Witt. Thank you so much for watching. My colleague Joshua Johnson is up next. He's got all the breaking news about Senator Rand Paul testing positive for the coronavirus.